يلا. Any idea? شباب.
دكتورة قصدك الفرق بين الويل والمودريت والبورلي differentiation؟
اي نعم، شلون نفرقها على اي اساس؟
دكتورة مثلا يعني المودريت يكون بانتراسيلولار بريدج وهير لايك بروجكشن ويسموه ديسموسوم.
تمام، هذا المودريتلي.
مودريت.
الويل سوري الويل ديفرنشيتد
الويل.
بهاي
دكتورة
مو همام؟
دكتور هذا المودريت. الويل يكون بالكيراتين بارلل ويكون
همام الويل ديفرنشيتد مثل ما قلت containing intercellular bridges and keratin formation. Moderately differentiated only keratin formation without cellular bridges. والpoorly differentiated لا هذا
يكون لوست.
نعم.
ويحتوي على ترايبولر مايتوسيس.
tripolar mitosis هذا features of atypical mitosis موجودة بأي type of malignancy.
malignant. نعم.
أي type of malignancy.
كبورلي يعني.
تمام. atypical mitosis ممكن نشوفها in any type of malignancy. هي feature يسموها sign qua non of malignancy، يعني ما يصير إلا بالmalignant mitosis أو malignant cells. Okay, then squamous cell carcinoma of the skin of the penis can be classified according to the grading إلى well, moderately and poorly differentiated. هذه regarding the squamous cell carcinoma كلها إذا بالoral cavity أو بالesophagus أو بالskin أو cervix كلها well, moderately and poorly differentiated according to these two factors. Testicular atrophy نشوفها دقيقة. This is testicular torsion, congested hemorrhagic blue dusky testis due to vascular twisting, venous twisting, and liable for hemorrhagic necrosis. Features of testicular cancer or testicular tumor. قلنا أهم feature هي painless أو painless hard scrotal mass. painless hard هذا presentation typical presentation. نقول لكم هيجي presentation هذا typical for testicular cancer. Painless firm or hard fixed scrotal mass. Typical presentation, typical histological features for seminoma. قلنا tumors of the testis are classified into seminomatous and non-seminomatous tumors according to the response to therapy, according to the biological marker secreted. So they are classified قلنا شباب إلى seminomatous and non-seminomatous. السيمينوماتس اللي هي السيمينوما والنون سيمينوماتس اللي هي الاندوديرمال ساينس تيومر اللي هي اليوكساك تيومر، الامبريونال كارسينوما، كوريو كارسينوما، هذه اللي هي النون سيمينوماتس مع in addition to يعني sometimes it is mixed with the teratoma اللي هي immature in male. Typical presentation, most common cancer of the testis هو السيمينوما. صحيح؟ It is identical شباب شو to what? It is identical to testicular seminoma. It is identical to شنو? To what? ذكرنا سابقا بالمحاضرة السابقة. It is identical. Testicular seminoma is identical to شباب معايا لو لا؟ Testicular seminoma is identical to which tumor? تفضلوا أخو، ما كل سؤال نظل ننتظر يعني ساعة. جاوبوا شباب, don't hesitate. What is the tumor identical to testicular seminoma? ها؟ Did you hear me? تسمعون؟
دكتورة يعني بغير يعني أورجان؟
غير organ إيه؟
كان بالأوفري ديسجيمينوما؟
Dysgerminoma, yes.
Dysgerminoma.
Dysgerminoma. It is identical to testicular seminoma. Both of them are originating from germ cells. زين germ cells. شوفوا شباب اللي قلنا عليه الميكروسكوبيكال features هذه كلها germ cells تشبه germ cells within the seminiferous tubules. Recall the morphology of the germ cells تكون هيك large with prominent nucleolus, immature cells. هذه تشبه الجيرم cells within the seminiferous tubules اللي هي تصير بالperiphery until the central formation of mature spermatozoa. زين microscopically features cells nests of cells with fried egg appearance. يشوفوها تشبه الفرايد egg because of well or distinct cell border, distinct cell membrane, rounded nucleus and central nucleolus with characteristic stroma infiltrated by mature lymphocytes. زين وهذا هو الاتيبيكال ميتوسيس اللي قلنا عليه occurs only in malignant cells. زين this is the solid hard fixed mass within the scrotum. هذا شنو شباب مننا شنو اللي يعرف شنو هذا شنو برأيكم؟ What is this tissue? هذا normal. This is the normal non-tumorous testicular tissue. This is the tumorous testicular tissue.
Ededemas.
يعني هذا remnant of the testis that is not neoplastic, not involved by the tumor. يجي شلون يكون شكله orange colored. وباعوا الميكروسكوبيكال features from the low power and higher power. This is the low power. You can see stromal infiltration by lymphocytes, and these are the cells من تكبرون عليها تشوفون هذا الappearance. شوفوا شباب fried egg cells or fried egg appearance due to distinct cell border, rounded nucleus, prominent nucleolus, and perinuclear clear vacuoles. The stroma is infiltrated by mature lymphocytes, nests of germ cells, malignant germ cells with fried egg appearance اللي هي مثل ما قلنا وصفناها, and the infiltration of the stroma by mature lymphocytes. Okay, so germ cells and lymphocytes in both seminoma and dysgerminoma. This is another picture, showed you the solid tan colored hard testicular tumor, proved microscopically to be the most common tumor, which is seminoma. What is the age group, most common age group تقريبا للسيمينوما 35 to 55 صحيح تقريبا هيجي 35 to 45 involving younger age group. The more aggressive tumor is اللي هي قسمناها إلى سميناها non-seminomatous germ cell tumor. الامبريونال كارسينوما سموها كارسينوما هي because they are containing glandular, هي مو كارسينوما وإنما containing acinar or glandular structures. It's more aggressive with bad prognosis or poorer prognosis than seminoma and but less response to chemotherapy. Choriocarcinoma, look for the cytotrophoblast and sensitotrophoblast. وقلنا هذه التيومرز كلها كان secreting biological tumor markers like alpha fetoprotein, beta HCG, and Yolk sac tumor or endodermal sinus tumor involving younger age group and children. Characteristic هذا الكل rosette-like structures, aggregation of the tumor cells around blood vessel called Schiller-Duval bodies. Schiller-Duval body. Characteristic of Yolk sac tumor. Characteristic of Yolk sac tumor. Schiller-Duval bodies. التيراتوما شباب، حكينا على التيراتوما وقلنا عليها التيراتوما شنو حكينا عليه، شنو characterize or recognize from female teratoma of the ovarian teratoma. قلنا most of testicular teratoma are immature. من نقول immature معناها malignant أو associated with malignant transformation. Teratoma معناها presence of multiple cell or organoid component of many cell derivatives from more than one germ cell layer من الميزوديرم, endoderm and ectoderm. السكس كورد stromal tumors عادة قلنا شنو قلنا السكس كورد والجيرم سيلز شنو قلنا عليهم؟ شباب شنو قلنا، شنو الفرق بيناتهم أو شنو اللي يميزهم؟ عادة السكس كورد تيومر عادة تكون benign Leydig يعني recall the cells original cells of the sex cord or of the stroma or the testicular interstitium. They are Sertoli and Leydig cells, so corresponding tumors are Leydig cell tumor and Sertoli cell tumor. Sertoli cell tumor are supportive cells within the seminiferous tubules, and Leydig cell tumors are interstitial aggregates of cells. The tumor of them are usually benign. Teratoma in male is usually containing many cell components from different embryo germ cell layers and usually malignant in the testis. وهذه biological markers beta HCG alpha fetoprotein placental alkaline phosphatase, they are important for testicular tumor follow-up and monitoring of the tumor. Prostate, regarding the practical part, قلنا الprostate acute prostatitis, characteristic neutrophilic infiltration within the acini or within the glandular structures, neutrophilic exudate, neutrophils are characteristics of with edema and edema fluid and necrosis are features of acute prostatitis, whereas chronic prostatitis, lymphocytes and plasma cells are the main infiltrating cells, in addition to stromal fibrosis and as well as glandular destruction. Granulomatous prostatitis منو الأشهر واحد which is the most common type of granulomatous prostatitis هو tuberculous مو صحيح؟ tuberculous prostatitis TB infection. ال BPH features قلنا ال BPH is benign prostatic hyperplasia and hypertrophy, both hyperplasia and hypertrophy of the glandular and fibromuscular stromal elements. وقلنا شباب ال characteristics of the clinical presentation يختلف because of different from prostatic cancer because BPH or benign prostatic hyperplasia affecting the central zone or the periurethral area result in urethral obstruction. So the patient seek medical or surgical or medical advice or consultation earlier than in patient with prostatic cancer because he complaining of features of lower urinary tract obstruction. So bladder neck obstruction, urine frequency, urgency, hesitancy, and urine retention. This is related to obstruction of the urethra by enlarged hyperplastic prostatic gland. You can identify the bulging well-defined bulging nodular appearance of the hyperplastic prostate, enlarged, bulged, nodular. شوفوا nodule formation, bulged out, tan colored. بالpalpation تكون rubbery, not solid, يعني not hard. Compressing the urethra. The urethra here is compressed and constricted, obstructed. Microscopically, the typical and important features are hyperplasia of both the glandular element and the fibromuscular element. The glands are hyperplastic. تذكرون تذكروا أي hyperplastic gland, endometrial hyperplasia, Graves' disease, follicular hyperplasia, cellular crowding, elongation, tall cells, tufting or pseudo-papillary formation, and the glands are typically lined by double layer. The underlying spindle myoepithelial cells and the secretory tall columnar or columnar cells or low tall columnar cells, and this surrounding hyperplastic fibromuscular stroma. And we call it muscular because the muscular component are important for pushing of the secretion. Again, the double layer or bilayer lining of the gland is characteristic of benign glands. This is the underlying spindle myoepithelial cells and the inner lining secretory cells within a hyperplastic gland and surrounding hyperplastic stroma. So both glandular and fibromuscular stromal hyperplasia. Corpora amylacia are inspissated, thick intraglandular secretions نسميها corpora amylacia. It is a feature of benign lesion also. شوفوا شكلها شلون calcified, lamellated, eosinophilic acellular material within the gland, within dilated hyperplastic glands surrounding. So benign prostatic hyperplasia. Again, look for the bilayer lining within a hyperplastic gland, increasing the number and diameter and the number of the glands and number of cells. Prostatic hyperplasia histology. We say that is prostatic cancer is clinically silent at the start because it affecting the peripheral zone and can be palpated by rectal palpation because it is adherent to the rectal wall. So this is an ill-defined mass. You can identify ill-defined whitish infiltrative mass involving the prostatic tissue. The BPH here in the center, dilated hyperplastic glands within the central zone, and the peripheral zone is involved by this tumor mass. This is a tumor mass proved to be prostatic cancer. And the typical microscopical appearance or feature is what? What is the typical microscopical feature of prostatic cancer, of glands in prostatic cancer? What are the
دكتورة single layer مال جسمه.
Yes, glands lined by single layer without supportive myoepithelial layer. You can recognize this benign gland at the left side and that are lined by double layer cell or bilayer, and the tumor which is made of monolayered glands. ولا تتذكرون شباب بالمحاضرة قلنا أكو فد grading system important for نستعملوه بالgrading for prostatic cancer يعني to differentiate low grade, moderate and high grade prostatic cancer. شنو سمينا؟ شنو كان اسمه؟
دكتورة Gleason system.
Gleason grading system for grading of prostatic cancer. Only grading is important with prognosis and response to treatment. Again, prostatic adenocarcinoma, malignant gland lined by single layer, no myoepithelial supportive layer, and these glands infiltrating the stroma separately and surrounded by a fibroblastic reaction. هذه الفيتشرز اللي هي of late distant metastasis, late stage or stage 4 prostatic cancer. Sometimes the patient presented clinically as low back pain or fractured vertebra or fractured rib due to metastatic deposit of prostatic cancer. لحد الآن أكو سؤال شباب على الميل reproductive system. BPH, prostatic cancer. أي سؤال أكو شيء لون can we move to the female reproductive system slides? Can you share with me the female reproductive system slides? التيومر خلينا نشوف بس الشباب lining epithelium of the vulva squamous, لهذا نسميها preneoplastic lesion for squamous cell carcinoma of the vulva is valvular intraepithelial neoplasia. The same criteria of Bowen's disease, نفس الشيء, whole thickness or full-blown dysplasia involving even the uppermost layer, dysplastic changes, and the next layer, it is pre-malignant, can predispose to invasive squamous cell carcinoma, valvular intraepithelial carcinoma. CIN is much more common. Here, the invasion is prominent, invasion of the underlying structure, subepithelial structure by malignant squamous cell epithelium. The cervix, ectocervix, squamous epithelium, and the endocervix lined by columnar epithelium, and in between is the squamocolumnar junction, which is the most common site infected by oncogenic virus, human papilloma virus 16 and 18. Here microscopically it is seen as such, squamous epithelium, stratified squamous epithelium, the junction, and the squamous and the lining columnar epithelium, here underlying features of chronic cervicitis, heavy plasma cells, and lymphocyte infiltration. This is the هاي نسميها transformation zone. The transformation zone in which the human papilloma virus infection is most commonly involved in this area. Also, as well as قلنا بعد منه layer that is the cells that is infected by human papilloma virus شباب غير transformation zone. Which cell are also can be involved by human papilloma virus infection. Two types of cells are infected by human papilloma virus, oncogenic virus. منو هي؟ قلنا البيزل سيلز شباب، هذه البيزل سيلز من يصير ulceration بالسكويموس epithelium يصير erosion. This basal layer will be exposed. These are more liable for human papilloma virus infection in addition to the cells of the transformation zone. Okay. هذه النورمال keratinocytes seen by pap smear. واللايرز هذه كلها اللي قلنا عليها السكويموس والميتابلاستيك سيلز والكولومنار سيلز وهذه هي البيزل layer والtransformation zone والsquamocolumnar junction between the ecto and endo cervix. The cervical polyp, عادة inflammatory endocervical polyp containing hyperplastic endocervical gland with inflamed stroma and edematous stroma with embedded endocervical gland lined by columnar epithelium. Cervical intraepithelial neoplasia, CIN1, classified into CIN1, equivalent to mild dysplasia, CIN2, moderate dysplasia, and CIN3, severe dysplasia, equivalent to carcinoma in situ. According to the severity of dysplasia involving the three layers. So normal CIN1, one lower third, CIN2 middle third dysplasia, and CIN3 full-blown or three layers or three up, even the uppermost layers involved by dysplastic changes. Here the CIN3 and CIN1 to 2 and here still we can see maturation present in the uppermost layer, so it is not CIN3. Whereas this picture, you can identify mitosis, high NC ratio, and dysplastic changes even involving the uppermost layer. So it is equivalent to carcinoma in situ. And this the gross appearance can be seen as such. شباب مثل اللوكوبليكيا قلنا regular patchy whitish and sometimes red velvety appearance. It is cannot be differentiated as CIN1, 2, 3 or carcinoma in situ or invasive cancer unless it is proved by pap smear or histopathological biopsy, and إما biopsy أو pap smear or semi-papanicular stained smear from this ulcerated or abnormal cervical area, endocervical and ectocervical area. Normal squams or normal squamous epithelium can be identified here as polygonal cells with folded boundaries and small nuclei, whereas CIN1 increase in high NC ratio, prominent nucleoli, and finally clumped chromatin. هذه low grade CIN. Infiltration, this focus or this picture, it is called micro-invasion. It is the start or earlier infiltrative process of carcinoma in situ when it is transformed into invasive squamous cell carcinoma. Gross appearance is ugly looking, hemorrhagic mass with areas of necrosis and bleeding within the cervix, ectocervix, and here the invasive component. Cervical smear or malignant pap smear هذا شباب, these are the non-neoplastic or the earlier but the cells in the center here, high NC ratio, prominent nucleoli, coarsely clumped chromatin, وهذه الفيتشرز اللي سميناها tadpole appearance or tadpole cell مثل كرة المضرب, elongation of the cytoplasm with keratinization. هذا ال orange color is due to keratinization. So invasive squamous cell cancer and pap smear. اوكي لحد الآن اكو شباب سؤال على السيرفكس, على الباب سمير, على السيرفايكال كانسر and CIN1, 2, 3. The uterus, disease of the uterus, قلنا features characteristic of endometritis. ما نقول endometritis because of lymphocyte and neutrophils are common unless we can see plasma cells. So plasma cell infiltration is a characteristic for endometritis, chronic endometritis, and these are foci نسميناها blue, hemorrhagic or burned powder or powder burn appearance of endometriotic or endometriosis, endometrial tissue implantation within the peritoneum, within the ovaries, fallopian tubes, within the abdominal cavity, the rectum, bladder, and so on, related to theory اللي حكيناها بالنظري. And the blue color, the brown color related to old blood collection. سميناه chocolate cyst. It is not more than الاسم العلمي أو pathological name for chocolate cyst is ovarian endometriosis. Microscopically can identify endometrial tissue. شوفوا هذه endometrial glands, the cell Hemosiderin-laden macrophage that are features of bleeding, all the bleeding with the layers of bleeding and surrounding fibrosis sometimes. Here in the ovary, this is the ovarian tissue stroma, and the implanted or embedded endometrial tissue. وشباب قلنا لازم نشوف endometrial gland and stroma. Both of them, we should find both glands and stroma to diagnose يعني هذه endometriosis. إضافة إلى أو قد تكون features of old bleeding within the ovarian tissue, because only endometrial glands implanted can be a feature of metastatic endometrial cancer. So endometrial gland, so the gland should be benign in nature. Endometriosis, the same process, it is present within the wall of the uterus, within the myometrium. Here we can see hemorrhagic foci within the myometrium, in addition to the spongy thickened wall of the uterus. It is called, or it is related to adenomyosis, embedding or deep invagination of the endometrium into the myometrial wall. The presentation, the typical presentation of the patient here, menstrual irregularity, menstrual bleeding, heavy menstrual bleeding, or menorrhagia or dysmenorrhea, pain during menstruation. These are the typical presentation of adenomyosis. So adeno referred to gland, meiosis within the myometrium. Foci of bleeding within the myometrial wall. Endometrial polypoid lesion. عادة endometrial polyp are hyperplastic polyp. Within the, it is here adherent to the upper endometrium as a polypoid lesion. Again, the presentation of this lesion is heavy menstruation, menorrhagia, irregular menstrual spotting, or irregular menstrual or irregular bleeding. Also, repeated abortion can be presented with infertility due to repeated abortion and difficulty for mature ovum fertilization and implantation of the embryo. Also pain during menstruation, or spotting, or heavy menstrual bleeding or loss. This is the microscopical appearance of hyperplastic endometrial polyp. Hyperplastic endometrial polyp, you can identify dilated hyperplastic glands, elongated, irregular, or cystic glands within surrounding spindle stroma, and also increase in the number of these glands. نسميها high gland to stroma ratio. endometrial hyperplasia. والمهم بالاندومتريال hyperplasia انه احنا ندور على features of atypia, because atypical changes are precursor for endometrial carcinoma. Atypical endometrial hyperplasia is a precursor for endometrial carcinoma. بينما benign non-atypical endometrial hyperplasia are not precursor for endometrial carcinoma, but can progress to atypical hyperplasia, and so need follow-up and frequent endometrial biopsy, and requiring follow-up. The most common tumor of the female genital tract is endometrial is leiomyoma. Leiomyoma أو كلش مشهور أو يسموه uterine fibroid. Uterine fibroid هو الحقيقة misnomer. This is a misnomer. It is not fibrous. It is a smooth muscle tumor of the originating from the myometrial wall, from the cervix, or at the broad ligament sometimes. It is composed, you can see this is the encapsulated tumor, well-defined, encapsulated, surrounded by capsule or pseudocapsule, fibrous layer from the uterine wall. The cut section is tan-colored, rubbery, whorly. Whorly, شباب W-H-O-L, whorly, W-H-O R-L-Y, whorly, W-O-R-L-Y, due to intersecting أو interlacing smooth muscle bundles مثل كرة الصوف. There is interlacing or intersecting smooth muscle bundles at the cut section. Rubbery appearance with this you can see the cut these are the cross sections and the elongated are the long sections. The characteristic is cigar shaped or sausage shaped cells with rounded nuclei. The features of smooth muscles. Uterine leiomyoma is the commonest female genital tract tumor. والاتيبيا rare بيها. أكو بيها variants with atypia, with increased mitosis, with increased cellularity, but commonly it is benign. والmalignant counterpart مالتها هو leiomyosarcoma. So it is a stromal tumor. Endometrial carcinoma is a tumor of the female genital tract, malignant tumor of the female genital tract, involving the endometrium. Here you can see ugly looking tumor mass involving the endometrium and occupying the endometrial cavity with foci of bleeding and necrosis, and the glands are characteristic glands مثل عادة هي malignant gland back to back. ماكو ستروما مثل الهايبربليزيا back to back or proliferating glands with some يعني بالاريال stages تكون only within the endometrium. بعدين يصير بها invasion to the myometrium and even to the serosa or adnexia or cervix. Carcinoma of the endometrium. Endometrial carcinoma, irregular growth. You can see here irregular, whitish, ugly-looking growth involving the lower uterine segment endometrium. The upper segment here is not affected. This is an advanced stage of endometrial carcinoma, malignant tumor of glandular origin, originating from the endometrium, infiltrating the wall, infiltrating the myometrium, and even can reaching the adnexial heel ovaries and broad ligament and fallopian tubes and even the cervix. وهذه كلها صعد الستيج. Okay. Regarding the endometrium, regarding the ovaries, شباب, you should know the for identification of the tumor. You should know the origin of the tumor from the layers or the parts اللي هي most commonly from the surface epithelium or germ cell layer or the sex cord stroma. The ovarian cyst نقسمها الأوفريان cyst قسمناها إلى physiological cyst مثل الfollicular cyst والcorpus luteum cyst, physiological cyst and the also the Stein-Leventhal syndrome, the polycystic disease of the ovary. They are related to hormonal imbalance or certain syndromes, polycystic ovaries, multiple cortical cysts within the ovarian cortex, and associated other clinical manifestation اللي حكينا عليها and irregular or abnormal hormonal study. Tumors of the ovary, شباب, tumors of the ovary are originating from neoplastic cyst here. Neoplastic cyst, قلنا neoplastic cyst are يعني نقسمها إلى benign borderline and benign borderline and malignant. أيضا prognosis يختلف. Ovarian tumors classification according to the 3 layers and 4 metastases. The first one, اللي هو most common one, up to 70% is originating from the surface epithelial tumor, ونسميها epithelial tumor, اللي هي serous, mucinous, endometrioid and Brunner tumor. وقلنا السيرس والميوسينس نقسمها إلى benign serous, borderline serous tumor and malignant serous cystadenocarcinoma. والميوسينس نفس الشيء, mucinous cyst, adenoma, borderline mucinous tumor and borderline mucinous cystic tumor, يعني tumor and malignant mucinous cyst adenocarcinoma. Endometrioid, because similarity, morphological similarity to endometrial carcinoma and Brunner tumor, and the germ cell tumor اللي هي mature, عادة mature اللي هي التيراتوما, mature نسميها mature cystic teratoma أو dermoid cyst. المalignant هم الديسجيرمينوما, يوكساك tumor, choriocarcinoma and embryonal carcinoma, whereas the ovarian sex cord, قلنا الovarian sex cord tumor هي benign usually, ما عدا الجرانيولوزا سيل تيومر اللي تصير بالchildren تكون شوية بيها يعني aggressive behavior, whereas the fourth هو الكروكنبرغ metastatic tumor. So surface epithelium, serous, mucinous, endometrioid and Brunner. والجيرم سيل اللي هو 20% تيراتوما, الجيرم اللي هي الماتشور cystic teratoma, dermoid cyst, dysgerminoma, embryonal carcinoma, yolk-sac tumor and choriocarcinoma, and the sex cord tumor اللي قلنا عليها granulosa cell tumor, theca cell tumor أو thecoma, وده صار mixture of both theca cell and fibrous cells or stromal fibrous cells نسميها fibrothecoma. Sertoli-Leydig cells مثل ما قلنا شباب هو sex cord stromal tumor can differentiate into testicular or ovarian stromal tumor like testicular اللي هي Sertoli-Leydig cell tumors. Benign stromal benign والgerm cell عادة malignant ما عدا mature cystic teratoma. والميتاستاتيك هو اللي سميناه الكروكنبرغ اللي هو الأشهر شيء signet ring tumor from the stomach or from the intestine, عادة ممكن يكون bilateral or can originate from endometrium or from the breast or from the lung even. The surface epithelium اللي قسمناها إلى again serous borderline, serous cystadenoma borderline and malignant serous cystadenocarcinoma. هذا البناين, شوفوا lining epithelium is benign, no malignancy, والcyst قد يكون multilocular lining epithelium ما بي intraluminal growth, بينما وهذا this is the microscopic appearance of malignant serous cystadenocarcinoma. Serous cystadenocarcinoma. This is the cyst cavity, and this is the malignant growth with features of malignancy infiltrating the cyst wall. Calcification or psammomobody is a common feature تشبه الpsammomobody of papillary carcinoma of thyroid. ممكن هاي نشوفها بالperitoneal seeding is very common in serous malignant serous cystadenocarcinoma of the ovary. Tumor of elderly women. Multiple calcified psammomobodies within with seeding, sometimes within the tumor or within the ovarian tumor or within the peritoneal cavity. الميوسينس تيومر نفس الشيء شباب. cyst adenoma or benign cyst adenoma, borderline and malignant cyst adenocarcinoma. هذا اللايننج اللي هو الميوسينس cup shaped nuclei or cup shaped cells بها vacuole كبيرة، وهذا هو الميوسينس cyst. إذا benign ما بي intraluminal growth. This is a multilocular، نسميه multilocular بعدة cavities. إذا أكو growth ناخذ من عند يعني biopsy should be taken to differentiate malignant from benign cyst. يعني الأوفريان cyst can be malignant. زين، اللي هو Serous cyst adenocarcinoma and malignant mucinous cyst adenocarcinoma. شوفوا هذا الفالوبيان tube، وهذا sometimes intraluminal growth within the cyst can indicate malignancy. Here no malignancy can be seen, no invasion of the underlying stroma. Endometrioid tumor. Endometrioid tumor نفس ال features of endometrial carcinoma. يسموه endometrioid tumor because similarity or differentiation toward endometrial tissue. عادة malignant، والبرنر gland عادة benign أو transitional cell tumor أو transitional cell tumor Brenner tumor containing cells of transitional epithelium of like transitional cells of the urinary bladder Brenner tumor or called transitional cell tumor. هذول كلهم epithelial. whereas the germ cell tumor شباب التيراتوما 95% are mature. ونقول mature معناها mature cystic teratoma or called dermoid cyst. The others are malignant. Dysgerminoma اللي هي identical to testicular seminoma, embryonal carcinoma, yolk sac tumor, and choriocarcinoma. Okay, the dysgerminoma, mature cystic teratoma or dermoid cyst differentiation into many germ cell layers, endodermal, ectodermal, or mesodermal differentiation. Here ectodermal اللي هي يسموه epidermosis because mainly containing skin element with skin adnexia and appendages. Here there is hair tuft with sebaceous gland secretion, neural tissue, cartilage, thyroid tissue, respiratory epithelium, brain tissue. هذه هي most commonly seen element. Bone and cartilage can be seen, even tooth production. هذا هو skin lining أو epidermoid أو dermal and epidermal tissue, and this is the neural tissue like brain tissue, sebaceous gland. So differentiation into many germ line layers. This germinoma, recall the fried egg appearance, identical to testicular seminoma, nest of germs, malignant germ cells with intervening stroma infiltrated with lymphocytes. This germinoma is malignant. لازم تعرفون من المalignant من البناين. Endodermal sinus tumor. هذا شنو structure شباب؟ شنو سمينا؟ characteristic structure of yolk sac tumor. قبل شوي ذكرناه بالتستس. شنو اسمه؟ structure. This is perivascular cellular arrangement. Any idea؟ أحد عنده فكرة؟ شو سمينا؟ من chiller duval body. Okay, perivascular tumor cell collection. Choriocarcinoma, just like the testicular and the placental counterpart. These are the cytotrophoblast and forming the choriocarcinoma, tumor of placental side or placental tissue, malignant tumor of placental tissue. قلنا الstromal sex cord stromal tumor are usually benign. Germ cell tumors are usually malignant, except for mature cystic teratoma in the ovary. هذا التيومر شنو اسمه شباب؟ اللي بيه call exner bodies. It is a sex cord stromal tumor. منو هذا؟ هو شنو هذا التيومر containing called external bodies. This is the granulosa cell tumor. Granulosa cell tumor يكون aggressive during childhood and adolescent. عادة هو يعني عادة الsex cord stromal tumor are benign, but if it is presented in يعني in adolescent or young age group, it will behave in aggressive manner. Called external bodies, rosette-like collection of tumor cells in granulosa cell tumor. Leydig cell Sertoli tumor مثل ما قلنا it is a sex cord stroma. So differentiation of the testicular stromal cells or ovarian stromal cells can occur. Leydig cell tumor is a benign tumor of the can arise in the testicular seminoma. Testicular, arising from ovarian stromal tissue. It is a sex cord stromal ovarian tumor. Fibroma is another. شكلها الفايبروما تكون whitish والثيكوما because containing theca cells, luteinized cells containing fat or lipid vacuole يكون شكلها yellowish والفايبروما is whitish. Sometimes mixture of both called fibrothecoma. Fibrothecoma can see spindle cells, spindle cell tumor with collagen bundles in the stroma, producing collagen bundles. Fibrothecoma, fibroma, or fibrothecoma mixture of both. So both of them, all of them are a sex cord stromal tumor, benign in nature. The last one هو metastatic tumor, forming only 5% of all ovarian tumor. Metastatic tumor, occupying. You can see here the tumor is totally occupied and infiltrated by malignant deposit, mainly from the gastrointestinal tract. Semi-Krukenberg tumor, commonly from diffuse gastric cancer or colorectal cancer, or even breast cancer. It can be bilateral or even from the endometrium and lung. إذا أكو سؤال شباب على الفيميل والميل والفيميل structures, female or genital organs, tumors or anything إذا تحتاجون أعيد فد شيء قول. Any question, don't hesitate and come on. You are welcome.